Hi, I'm Dr. Barry Resnick in Aventura, Florida at the Resnick Skin Institute, and we're going to be demonstrating how we use Bellafill to fill what we call the melolabial folds. These are those folds that goes from nose to mouth. And we have our lovely client here, Roxy, who is going to undergo this procedure. Bellafill is a long-term filler. The studies have shown that it lasts up to 5 years, but some people get a lot more out of that, and some people get a little bit less. Nicely, this stuff goes in through one tiny opening instead of multiple needle sticks. We use something called a micro cannula, which is dull at the tip, so I'm not going to be piercing any blood vessels, and that results in a lot less bruising. Bellafill has been available since 2006. It used to be called Artefill. Artefill is now marketed as Artefill in South Korea. This stuff is marketed here as Bellafill, and it works really well. So what we're going to do is we're going to make a little entry point right at the base of the line. And I'm going to use my cannula to go up to the top, and we're going to fill as we pull out. Put a little bit down here. Smile for me, wait please. So we've got this little crook here, a little opening here that we want to soften. Relax. So we're going to start by using a little bit of numbing. Here's your little pinch. We're going to make our little opening. And we're going to advance it up. Now, I have had this done, and it feels like a scrunching sensation. That's the best I've got, but it doesn't hurt, which is really nice because most people don't like pain. So I'm slowly injecting as we go. Are you having any pain? Thank heavens. Okay. So I'm going to be very superficial. I am just under the skin right now. I'm in the upper layer of fat. And at the end of the injection, I'm going to mold it a little bit. Smile for me. Relax. Relaxing. So you can see that it's softened already. Just relax there. I don't know if you can see this, but you can see the tip as we're going along, and that way I'm always assured I know where the Bellafill is going. Always like to be in control and make sure that it stays where we want it to stay. And you can tell that she's not having a whole lot of pain. There's no wincing, her eyelids aren't fluttering, she hasn't fainted, so that's always a good sign. So I'm going to direct towards the corner just a little bit. I'm going to fill that area right there. And just a little bit into the corner here. And a little bit into the corner here. We're going to follow her lower lip line down. You can see it's right there. Good. Okay, so you can, if you could feel this as I am, there is no lumpiness here. I've laid it down in a nice even line. I've got just a little bit left on this side, so I'm going to pay a little bit more attention to the lower fold, which is a bit more prominent. There we go. Okay. You see throughout this, very little bleeding. And you can actually see, just taking a look at both sides, I brought the corner of her mouth up a little bit. I filled in this little indentation that she's gotten here. And with this tiny little bit left, I'm going to deposit it right at the corner. Okay. So, you doing okay, Roxy? Yeah, you would say nothing but. I know. Okay. So, we're going to go ahead and make our little numb area and then make our entry. Thank you. Pinch. Should feel that little bit of burning. And then nothing. Entry. Good. So I can feel where my tip is, and I can actually see it right up there, and I'm going to start laying down the line there. There's always a little bit of blood, but she's not going to have any bruising. I haven't had bruising yet with this stuff. I'm always paying attention to where the tip is going. And when I want to be superficial to fill in a line, I can do that. And when I want to place it deep for more volume, I have that option as well. My goal is always to make people look as naturally beautiful as possible. We're conservative with this stuff. I like to say I'm conservatively aggressive. I'm going to put as much in as I think is good. I'm going to have her back in a month to reevaluate. We may need to add a little bit as we go. Now I'm going to start working that little corner, and I'm going to switch sides right now. So that I can pay attention to this corner. And we're going to go up to the top of the lip corner. We're going to go right into the corner there. And then I'm going to give her a little scrunch over here. The fat has very little in the way of nerve endings. So once we're through the skin, which is what hurts when we do this stuff, we don't have much in the way of discomfort. And as you can see throughout this entire process, Roxy, who fainted about 5 minutes ago and hasn't regained consciousness, filling in that corner like I did before. Excellent. You can see that both corners are now nice and lifted. Smile for me. This is much softer than I was before. I'm going to put just that little bit left right as we go. I want it to be a little bit more superficial. End result is a more beautiful Roxy. So we're going to let that settle in. I'm going to go ahead and do a little bit of massage there. Thank you. Some people do massage, some people don't. I'm not going to be pushing this stuff around. I just like to make sure that it is where I want it to be. There are no lumps, no collections. Casey's going to clean her off. She's not going to need any aftercare, little ice pack. The two little entry points are going to be gone by morning. And we'll see her back in a month and reassess. There you go. How did it match up to your imagination?
Actually, it wasn't as bad as I thought. I was more nervous, and I was nervous about the pinching, and that was not a big deal
Mhm.
either. And then right after that, it was almost like I just closed my eyes, and it happened very smoothly.
Yeah.
It was more like it felt like it was just like a little wire going in and out in different places, but it wasn't hurting me.
Good. And I know that you haven't had much in the way of cosmetic procedures done.
I haven't had anything done because I've always been too scared. I've wanted
Okay.
to, but I've always been too scared.
So you've got two little needle points. They're going to disappear by tomorrow. They did on me. And you're not going to have any bruising because I didn't go through any blood vessels. So
That's why you have me here this
There you go.
Because I always wanted to do something, but I was always so afraid.
Mhm.
And this for me is like such a big thing because I was more on the afraid side that I would like just let it go. So I can be, now it's more like it wasn't really that bad at all. You know?
now I
I
know
worked
that
myself up for
I know that we have talked about other areas that we're thinking of doing. You know that it is labeled for injection into just these folds, but we've talked about giving you some fill back in your cheeks. And I know that you are of my age, 42, and we want to give a little bit more volume. We want to get rid of this trough as best we can, and we don't want to totally get rid of it because then we look funny. We look like we have balls in our cheeks, but we want it to look nice and full because when we lose volume, when we lose fat, the downward motion is always downward. It's never in. Gravity. So we're going to be using some here. We may put a little bit over the brow to give us back that nice Bucci brow that we used to have. We may go into the temple. There are all sorts of places to go. We may even put a little bit along the jawline because we all are developing pre-gels. I get to cover mine with a beard because all the ladies who come to me say, oh, you've got a beard. You don't care what you look like. And I do care what I look like, which is why I wear a beard. So, okay, I'm glad you had a good experience.
Oh,
All right.
Looking forward to the other side.
All right.